Changes when it comes to tracking severe obesity in kids. Expanded growth charts released this morning by the Centers for Disease Control and Prevention now include a body mass index of 60. That is up from previous charts that stopped at a BMI of 37. Rates of severe obesity among kids have nearly quadrupled in recent decades. Joining us live to talk more about this is Dr. Yvonne Friday from Children's Hospital of Michigan. And Doctor, thanks so much for joining us. Can you first explain what the body mass index is?
So the body mass index is a number that tries to compare your body mass of muscle, etc., with your height. And we say height because we can only do this, give you this number once the child is able to stand up tall. We compare that, we collect data from lots and lots of children, and then we put it in a formula that lets us know what the usual comparison of mass of muscle, etc., adipose tissue is compared to the height of a child, and then we extrapolate up based on what percentile that child is showing up as in terms of what number is that child at relative to all the other children that we've examined. It tells us about, we're hoping that information is going to be extrapolable to adipose tissue.
Okay, so when we say 60 up from 37, does that mean that we'll have even more cases of obesity?
What that is telling us is how far away that number is from what we call average, okay? So as you go up from, we think that the number is 30. When we go up to 60, that means that number is a lot higher than 30. But you need to know that when we do this, we don't really look at the number. We look at the percentile, because in children, like in adults, when you have a number that's important, you can kind of rely on that. But because children vary they change with their age. They change depending on what growth curve they were on in the first place. For example, if you're at the 50th percentile, then half the kids are below you, half the kids are above. So it is the percentile number that we use rather than the number itself, because as a child grows, that number is going to change as they're going on their up trajectory, as they go from being a smaller human being to a larger one. So the percentiles are really the numbers that we use more than the actual number itself.
So for an adult,
does that make sense?
It does. Yeah. So percentiles, of course, for kids, because you deal with that every time you go to the doctor's office with your child, right? You're always
and our percentiles are, yes, and they change whether male, female, and what their height is. So the percentile is related to the height, because I would judge someone differently depending on how tall they are. That's going to give me a different body mass index that I'm looking for. Does that make sense?
It does. So how, are you concerned about this, and what are you seeing, yourself as far as kids and obesity?
So we are so concerned that one of the things that the American Academy of Peds asked us to do is they initially asked us, can you please evaluate what we call dyslipidemia. Dyslipidemia is the amount of cholesterol in your system relative to how much they think you should have. They initially said, could you please check all of these kids at 7 to 9 years of age, people if they are at risk. Because people did not use the risk assessment, they made it mandatory. As of a couple years ago, every kid between 9 to 11 years of age should get a total cholesterol and the high-density lipids, because that's the quote-unquote good cholesterol, between 9 and 11. Let it fan out during puberty, and then once they get to 17, do that again so that we get a better idea. Has the dyslipidemia or has the elevated cholesterol gone up during that period of time? So they have now made it mandatory because we were seeing such an exponential growth of the BMI.
So what is one thing that you would tell parents to do about this?
So our issue in our clinic is it is not about weight loss. It is about activity. What activities can that child do? Not exercise. What activities is your child involved in to get those muscles moving? What beverages is your child drinking? Like 3-4 big bottles of a sweetened drink. Can we cut that down? Not only to decrease the amount of sugar that you're exposing the child's body to, but to decrease that exposure to teeth. Because we are also seeing the teeth of children are being exposed to so much sugar that they're not doing well either. So our big thing is, where's your activity? Can you get some of that activity into those screen devices and have them be active rather than looking at a screen? And can you check on how much they're drinking as well as the fruits and vegetables that they're putting in their bodies? So it's all relative. Can I increase those things up as they get older so that the lifestyle, the activity level, the calories that they are using up is increasing so that we don't deposit more adipose tissue?
And I would expect that having your kids do this now will help them when they're adults.
Exactly, because not only does it help one child, when I do this with one child, I do the whole family. So I am trying to get the entire family on a trajectory of more activity, less sugar in their diet, less salt in their diet. When I change it for one, I change that whole family. I often point to, I want blood flow to the brain, blood flow to the heart, blood flow to the kidneys to be as optimal as possible, because strokes, heart attacks, and the lack of and kidney disease are the things that I worry about most later on in life. As I start off now, I will improve the brain, the heart flow to the heart, and heart flow to the kidneys, and those are my vital organs.
Thank you so much. It was a pleasure to speak to you again. We've been speaking to Dr. Yvonne Friday. She is from Children's Hospital of Michigan. WWJ News Time is